An Unusual Case of H-Flu Septic Arthritis by Aaron Puneker, Dr. Heba Osman, and Dr. Mira Mitri. Septic arthritis is an acute erosive arthritis that arises secondary to infection of a joint space. It usually is caused by direct inoculation or hematogenous seeding. Risk factors we have to be aware of in our patient populations at all times include advanced age, pre-existing joint disease, IV drug use, and immunosuppression. Patients can actually present with warm, painful joints and concurrent effusions, but may or may not present with a fever. For bugs of interest, it should be noted that in healthy adults, Staph aureus and Staph strep species are the most common organisms. In sexually active persons, there's always a concern for Neisseria gonorrhea. However, in immunocompromised patients, rarer bugs like gram-negatives and fungal species should also be considered. Now we can move on to our case presentation. Our patient of interest was a 28-year-old HIV-positive male who presented with 10 out of 10 sharp right-sided shoulder, knee, and Achilles pain for the past 2 weeks. He endorsed cough, chills, and vomiting 2 weeks prior to presenting in the emergency department. During this particular visit, he denied any fevers, changes in urinary habits, penile discharge, or abdominal pain. The patient did have an oral sex encounter with another male prior to the onset of symptoms. He had a negative STI screening 1 week prior to presentation as well. The patient was compliant on HART therapy with a last known CD4 count of 321. He was actually pretty stable on presentation. On physical exam, there was tenderness at the right biceps tendon head and deltoid insertion without erythema, edema, or warmth. There was decreased range of motion of the right knee, along with swelling and tenderness. Tenderness was also present at the right Achilles tendon. So with this working diagnosis, we established a differential that included septic arthritis versus reactive arthritis versus a gout or pseudo-gout picture, along with rheumatoid arthritis and osteoarthritis. We proceeded to work up the patient. Outside of a WBC count of 11.2 on admission, the CBC was unremarkable, along with the BMP. His lactic acid level was low, while ESR and CRP were elevated. Now, due to concerns of reactive arthritis and rheumatoid arthritis, HLA-B27 and rheumatoid factor were obtained, and they came back negative. This is where orthopedics was consulted for a washout in the operating room. Here we were able to obtain a synovial fluid analysis, which was significant for H-flu bacterial growth, even though the PMNs were not significantly elevated. Along with this, 6 blood cultures and gonorrhea and chlamydia swabs were negative as they were taken throughout the admission. With regards to imaging, the right knee x-ray showed significant osteopenia with joint effusion, which can be appreciated in the pictures on the left. Due to concerns of ankylosing spondylitis, a lumbar x-ray was taken. You can appreciate the lack of bamboo spine, which is a classic presentation for the illness. This matched the negative HLA-B27 that was ordered. With the positive fluid analysis, the patient was started on ceftriaxone 2 grams IV daily. He was discharged on day 13 with a 6-week home regimen of azithromycin 500 milligrams. He followed up with the orthopedics clinic and showed vast improvement compared to initial admission. Now, with regards to discussion, it is interesting to note that prior to H-flu vaccines, the most common cause of septic arthritis in kids was actually due to H-flu type B. In fact, 41% of synovial fluid analyses in kids at the time were positive for the organism. Nowadays, it is much rarer. fewer than 10 case reports have examined this phenomenon in recent history. It is seen now more in immunocompromised adults. As a result of this, careful consideration and a broad differential should be taken into account for those on immunosuppressants or those with immunocompromised disease states. When deciding on treatment, ceftriaxone can actually provide adequate coverage. Other options to consider in the literature were ampicillin and chloramphenicol. If septic, it is important to consider adding on vancomycin. Now, the washout process, the incision and drainage can obtain a synovial fluid while simultaneously providing therapy to the patient. Thank you so much for taking the time to learn about H. flu septic arthritis and its management.